Well, it is wonderful to be back here at the Ryan Chelsea Clinton Center. Some of you have heard me say this before because I've been at this center, I've been at one of the other of the three centers, and when we named our daughter all those many years ago, we had no idea we were naming her for two neighborhoods in Manhattan, Scott. So, I mean, you know, we really are thrilled that this health center is named so appropriately as it is. I am so pleased to be here, and as you can tell, there are a lot of us who are committed in New York to the very simple proposition that every child should have access to quality, affordable health care. And we made a down payment on that with the SCHIP program, the State Children's Health Insurance Program, which I was part of enacting during the Clinton administration. But now it is up for reauthorization, which means the Congress has to act again to make it very clear we are going to continue our commitment to providing health care to our children. But I want to go a step further because I think that we are still leaving too many children out of the health insurance program known as SCHIP. I want to thank Barbara and her entire staff, Karen Westerveld, and everybody who makes this community health center so special. I've worked closely with Barbara and with the center over the last 6+ years in the Senate, and I'm a huge fan and great admirer of the work that is done. I also want to thank my longtime friend, Dr. Irwin Redlener. Irwin and I go back all the way to Arkansas, where he started health clinics in East Arkansas in the Delta. So I've known Irwin and his wonderful family and his staff for many years. And of course, he started with Paul Simon, the Children's Health Fund, which saw a gap, in fact, a tragic chasm in our provision of health care for our children. And this fund has done a marvelous job in trying to bring health care to the sickest, poorest, most isolated children. And because of Irwin's work on disaster preparedness, which I've also worked with him on, the Children's Health Fund was one of the very few organizations that went to New Orleans and the Gulf Coast, is still there, still providing health care, because as you know, the federal government left all those people behind. And so I thank Irwin for everything he's done. I want to thank my fellow elected officials, certainly my wonderful colleague in the Congress, Jerry Nadler. Jerry is a joy to work with. He and I have been on the front lines trying to make sure we get health care for the victims of 9/11. And we're not going to quit until we do. And I want to thank Speaker Quinn, who has just done a tremendous job as a member of the City Council, now as Speaker, in standing up for all the right issues and in being a wonderful advocate for the people, not only of her district, but of the entire city. And my other colleagues, I really appreciate them being here. You know, Dick and Gail and Tom and Linda and Scott, all of you are part of a team of hardworking elected officials. And finally, let me thank my assistant today and her family, because you know, if there is any doubt in anyone's mind about why we need health insurance for every child, take a look at Camilla and her little sister, Olivia. Oh, there she is. And as their dad, Bobby, said, and their mother, Pia, told me, the girls, like any babies and any toddlers, have had health problems and have had to, you know, get some medical assistance from time to time. And because of the Children's Health Insurance Program here in the state, they've been able to do that. And so I'm delighted that they came here to make their views known and to be such strong advocates of this program. Now, what I'd like to do today is to describe what else really needs to be done, because certainly our biggest challenge is to get the program reauthorized. And we believe we'll do that, but we want to do it in a way that furthers the goal of health insurance for every child, and not in any way either just remains stagnant or in fact goes backwards. So I want to announce today that I will be introducing legislation to make quality, affordable health care available to every child in America. And I want to thank my friend and the longest-serving member of the House of Representatives, Congressman John Dingell of Michigan. He's been a leader on behalf of a fairer, more affordable, quality health care system for decades, and he and I will be introducing this legislation together in the coming weeks. Now, it is simply wrong. We start from the premise. It is simply wrong for any child in America to go without health insurance. That's where we start. If you disagree with that, then obviously you don't share our values and our views that in the richest of all countries, we have both the obligation and now the opportunity to make sure no child does go without health insurance. I've worked in this field for many years, going, again, back to Arkansas and looking at the problems of getting a system that would serve every single child. Well, today, we know that we made progress, but we haven't gone far enough. And unfortunately, in the 10 years since we began the S-CHIP program, the number of the uninsured in America has increased. There have been cutbacks in recent years to Medicaid, which is essential in providing the health care safety net, in addition to proposed cutbacks in home health care and public hospitals, which is especially important, as Speaker Quinn said, here in New York. So what we are hoping to do is create a seamless network of institutions like this health care center, reimbursements for private physicians, and peace of mind for millions and millions of parents, that we can get children out of the emergency room and into regular care, preventive care, well child care, the kind of care that certainly Bill and I gave to our Chelsea Clinton and that we think every parent should be able to give to their children. So that's what I will be fighting for, and the legislation I will be introducing renews the S-CHIP program. First, that's the biggest, most important step we have to take. It expands the program, however, to millions of children whose families today cannot afford care. Children living 375% above the poverty level would now be able to access this program. Now, in New York, that is a family of 4 making $75,000 a year. And you like that, Bobby? You know, there are today millions of families that are considered too well off for Medicaid and S-CHIP. But you talk to them and ask how much it costs to try to take care of their children, and you'll find out they are foregoing essential care because they cannot afford it. They're trapped between the rising costs and the broken system, and we can help them get out of that trap. We also want for children in homes where the income is above that level to open up access to S-CHIP. For the first time ever under our legislation, families in America who need coverage for their children, regardless of their income, will be allowed to buy into S-CHIP. And my legislation also opens S-chip to employers. Because what happens is that a lot of employers, in their efforts to try to cut costs, are cutting the benefits for children. They are making it more difficult and expensive because within the system they are operating in, they can't afford health care for children to the extent children need it. So what I am offering is that employers will be able to buy into the S-chip program, and that way they will be able to offer affordable health care to employees for their children. I'm very excited and proud to introduce this legislation. This helps us honor our values and protect our children. And I'll be working hard to get this legislation passed in the Senate. And it will be another step toward the day when, once and for all, America provides quality, affordable health care to every single American. Thank you all very much.
We'd like to present the senator with some special cards and gifts.
Caleb.
I'm sorry.
Caleb.
Barbara, do you want to come out? Should the other kids want to come out?
Yeah, yeah.
Barbie, you have some more.
Caleb, go on the step right here. Go closer, go closer. Sit right here, too. Right here. Don't stand behind the podium. You see. Stay right there. Get closer. Okay, look to your left. Go in there. Space.
Come right up over here. Come on. If I feel down on one knee, might be helpful. Go down on one knee. There you go. You guys want to see here?
Okay, let's look up. Look up.
That's good, I think.
This was the leg.
We got a bad scene going on here.
Someone to the podium also.
Oh, that's good. I think that helps.
Yeah, just.
But don't touch it.
No one touch it.
Don't even breathe.
I got it. we, Jerry, can we straighten it? No, no, we're fine, thank you. It's just gonna look funny. It's just gonna look funny. Good, great. That's better.
Karen? Karen? Karen?
Hi, can you go down maybe?
Okay. Thank you so much. That's beautiful.
Right?
I'm going to take lessons. Erwin, I'm taking lessons from you.
Sorry, honey.
I'm taking lessons from you. I got my glasses on.
Erwin, don't.
Okay, Barb, you want to get your order?
Yes. Remind me, I do know. Hello, attention. I used to be a high school teacher before I found healthcare. On behalf of the Ryan family of community health centers, thank you all for coming. We will keep our fingers crossed that this legislation goes through as quickly as possible so that we can move on to covering all uninsured. And insurance is not the last step. It's coverage and access. Nobody can do it better than these folks here. I know that people will have questions for the senator, and she is delighted to be available for them. Senator? Okay. Now, if the press gets... Are there any questions? Press? People? Can't hear you. Shh.
Well, I think that the attention that has been brought to this issue today increases the effectiveness that I and my colleagues will have, because this is now an issue that is going to be on the front pages, and I'm looking forward to continuing my work on behalf of New York, working with my colleagues at all levels of government, especially with our new governor, who is going to make a tremendous difference. And we're just going to make a lot of progress here in New York. But we know in New York, and I think both Jerry and Chris alluded to that, we know in New York that if we don't have good partners in the Congress and the White House, we cannot make the progress we need to make. So I'm going to be working as hard as I ever have to make sure we make progress together in the next 2 years, and then I'm obviously looking forward to being in even a better position to help all of our country make progress on health care and education and energy independence, all the issues we know we should be addressing.
Senator, what role will your husband and Chelsea play in your campaign?
Well, they're my greatest support system, my greatest advisors, and they'll continue to be that.
You made your announcement, Senator, online. Why did you choose that route to announce your running?
You know, I think it was exciting for me because obviously we have all kinds of new media now, even more than when I first ran back in 2000 and certainly in previous elections, to reach millions of people throughout our country all at the same time, in the same way. And I'll be doing press conferences like we are today. I'll be starting tomorrow with a live web video chat with people because I want to have a conversation with our citizens about what we want for our country. And one of the goals that I will be presenting, as I said this afternoon, is health insurance for every child and universal health care for every American. That will be, a very major part of my campaign, and I want to hear people's ideas about how we can achieve that goal.
Senator, why do you want to be president of the United States?
I really love my country. I feel very fortunate to have been given all of the opportunities and blessings that I inherited and that my family inherited because of all the people who went before. And I'm worried about the future of our country, and I want to help put it back on the right course so that we can work together to meet the challenges that confront us at home and abroad in order to secure a better future for all of these children. And I believe that I am best positioned to be able to do that, and that's why I'm running.
Senator, when and how is last question?
I'm sorry, what?
Senator, also you said you weren't thinking about whether or not you wanted to be president. When and how did you actually make the decision?
I thought very hard about it, talked to family and friends and supporters after the election, and it was a thorough review for me about the problems that we confront in the country, the particular strengths and talents that I would bring both to the race and to the White House. And I concluded that based on the work of my lifetime and my experience and my understanding of what our country has to confront in order to continue to make opportunity available to all of our citizens here and to restore our leadership and respect for America around the world, that I would be able to do that, to bring our country together to meet those tough challenges, and therefore I decided that I would contest for the primary, and I'm looking forward to it. It'll be a great contest with a lot of talented people, and I am very confident. I'm in to win, and that's what I intend to do. Thank you all very much.